Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend some time with us, and I trust that you're going to find out a lot of very good information today. We're going to be talking about a topic that affects lots of families and is of an interest to me because it has affected many of my family members. And there's been a lot of news about this subject over the last 2 or 3 weeks because of some actions by the FDA. And actually, Friday, the death of Tony Bennett, who was a victim of this disease, among many others. So without further ado, and I hope I've teased you enough, without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Thank you, Dr. Neighbors. One day I'm going to ask you how to spell ado. I hear it all the time. Our topic today is going to be presented by our esteemed co-moderator, Dr. Ivan Walks. Dr. Ivan Walks I met years ago when I was at the NMA. He's a physician who was trained at UCLA Medical School. He subsequently did fellowships in psychiatry. He has been the medical director for the Department of Health, the city of Washington, D.C. He's been an advisor to U.S. presidents. He also did a stint as a Air Force, I don't know if it's a corpsman or what. Now, I don't know if we're a general or a colonel, but I absolutely got close to him when I met his wonderful mother. And the phrase that an apple doesn't fall far from the tree is heavily in mind. She is a wonderful, wonderful lady. And Dr. Walks, since he joined us on the Black Health Trust, has been someone who has added much intellect, much empathy, and I appreciate him agreeing to talk on this most important topic, which is Alzheimer's disease and dementia. Thank you very much, Dr. Walks. The floor is yours.
Thank you, Dr. Maxey. I'm going to impress everyone with my intellect right at the top. It's spelled A space D-O. All right, I'm going to try to share my screen here, Simon. Let me start by saying Dr. Maxey is very, very generous with his introduction, and I certainly appreciate all of the years that I have known him as a friend, as a brother, and also as a physician. I'm always upset with him because I am not my mother's favorite physician. Dr. Maxey is my mother's favorite physician. So one of these days, he and I will have to sort that out on the rough streets of South Central. I used to live right off of 29th and Western, Dr. Maxey. I can come back over there. Okay.
Let's go to dinner.
I'm sorry?
We have to go to dinner first.
Okay, you got it. All right. So I will hit the little slideshow button. Let's see. Oh, of course, that's what's happening. There we go. All right, can everyone see my screen?
Yes.
Okay.
Yes.
Thank you very much. All right, so we're going to talk about Alzheimer's disease. Dr. Maxey has given me about 30 minutes or so to run through this information. It's a lot of information. It's very important information. And as Dr. Neighbor Stevens said, all you have to do is live long enough and it's going to touch someone you know or someone you care about. And at the same time, while I was looking at information about Alzheimer's disease, I discovered that reportedly the youngest person to have been diagnosed with Alzheimer's disease is age 19. I'm gonna let that sit for a minute. because we talk about early Alzheimer's as folks who are impacted by this anytime earlier than 60 or 50, but it's part of the related causes are lifestyle and things that we do. So we have to be aware of what it can do. So let me start with that. So symptoms of dementia. Alzheimer's disease is a type of dementia. So it's not, so everybody with dementia doesn't have Alzheimer's, but it's a type of dementia. So symptoms can start slowly. I'm going to go through this pretty quickly. So Dr. Maxey, Dr. Neighbor-Stevens, Dr. Hines, if you want me to stop, just please interrupt me, because you all know how I am. I can just start running down the road. Forgetfulness, acting confused or disoriented, trouble with speech, writing, not being able to find the right words for things, trouble concentrating or reasoning, problems with tasks such as paying bills or balancing a checkbook, getting lost in familiar places. Now, as I read through this, these things can happen to all of us depending on what else is going on, right? We're stressed out about something. We haven't had enough sleep. We are in the middle of some significant amount of grief or trauma. So it isn't that the first time you have trouble concentrating, oh my goodness, I might have dementia. It's not that. And so we'll get into a little bit more about how do I know that it's something to really worry about. So Alzheimer's disease is the most common cause of dementia. There are other causes of dementia. Vascular dementia used to be called multi-infarct dementia, blood vessels. So basically, I tend to understand things very simply. So I'm usually pretty good about explaining them pretty simply. Blood goes to the brain works. When blood can't get to certain parts of the brain, those parts of the brain don't work. And so this vascular dementia is that. Other kinds of things, Parkinson's disease can cause a Parkinsonian dementia. Dementia can happen from, I've met people who are in their 30s that have dementia from trauma, a car accident, some other blow to the head. It can actually be a lifelong problem that can start for a lot of reasons, the whole dementia issue. Cardinal symptoms, we talked earlier about memory impairment. It's probably the number one thing that folks notice is that their memory isn't as good. So memory impairment isn't always the primary thing that people notice, but it is usually a part, and so certainly becomes a large part of Alzheimer's dementia as the dementia progresses. The pattern of Alzheimer's dementia is distinctive, the pattern of memory impairment, and we'll talk a little bit more about that. I will continue to run through cardinal symptoms. And I'm always mindful of the fact that a lot of the people who are with us on Black Health Trust are physicians. A lot of the people who are with us are not. And so for the physicians, if I run through something quickly, you guys know where to look it up. For those of us who are not physicians, I'm trying to make sure that this is as understandable as it possibly can be. Initially, and I'm going to talk from experience dealing with folks that I know. Initially, folks, certain parts of the memory are spared. No one begins a journey into Alzheimer's dementia by forgetting their family members. That's not how it starts. So, and they don't forget how to talk initially. So we look at the fact that different parts of memory are impacted at different times. Okay. And I'll make these slides available if someone wants to get them later. I can't send them now because I don't know how to send them now. And it's not because I have any sort of memory impairment. I just can't figure it out. But I will absolutely get them to Simon so they can be included in what we store. So clinical assessment. Clinical assessment is great, but family assessment. Anyone who is having some sort of a progressive decline in memory, and who depends on things being the same. I remember when my father, many years ago, the first sign of him having a problem is that they changed the route he normally took because of some construction, and he couldn't find his way back to where he normally went because of this sudden change in his environment. He could no longer navigate things, and it was a very serious challenge for him. And one of the things I'll talk about later is that people who begin to suffer from dementia initially will notice that something is wrong. They will begin to say, my memory isn't as good. I forgot this. I thought I did that. And then as the disease progresses, they will not be so much aware that they have that kind of a problem. So the other thing, and the last little bullet on this slide covers something that is so important. Adverse effects of medication, depression, metabolic disorders, meaning other stuff that might be going on in a person's body, other illnesses that may impact things like memory. And we'll talk a little bit more about that. There's no cure today for Alzheimer's disease. And I put purposefully no cure at this time, because there are a lot of folks spending a lot of time and a lot of money looking for a cure, because we kind of know about the plaques on the nerves and stuff. And so sometimes once we find something, we can find a way to get at it. And so that's what is happening, is folks are trying to find a cure for this most common type of dementia. So we'll talk about some drugs that temporarily ease symptoms of Alzheimer's, and we'll talk about some drugs that can temporarily change disease progression of people living with Alzheimer's. So progression treatment, and I put the names of the medications here just so we can know for sure that there are names of medications that work in this way. So the amyloid plaques that are the problem with attaching to the neurons in the brain and making the brain dysfunction and killing these neurons and what have you. There are ways that we can temporarily slow the progression of those. So we have some medications now that work by attaching to and removing the beta amyloid. And these cognitive measures that can be impacted in a positive way, things like memory, orientation, conducting personal finances, and household chores, are more functional as opposed to cognition. Now,
could you speak a little bit about just about what amyloid is in simple terms?
it's a protein that accumulates and piles up. It's sort of like if you think about other things that pile up and cause you problems, the picture that comes to my mind is doctors always talk about your cholesterol level is too high, and it's going to get into your arteries and stop the blood flow from flowing the way it should, and ultimately can cut off blood flow to certain areas. And so you can have things like a major heart attack is often caused by something not being able to work because stuff is being stored in a place that's not supposed to be stored. So you have this beta amyloid protein that kind of stacks up and forms these plaques where things shouldn't be. So we tend to have things working well. Something is there that shouldn't be there, and you wind up with beta amyloid plaques. Is that pretty simple, Dr. Maxey? That's how my brain works. You know that.
Yeah, it's true. You're right. Thank you.
Now, the thing I want to mention here, we get very excited, all of us, when we hear about a new medication that's going to treat this or treat that. These medications do have significant side effects. And as medications have been coming out that are there to treat Alzheimer's dementia, people are saying, and I've heard from doctors recently, as I'm talking about members of my family, well, we would use this, but the side effects really outweigh the benefits, or the benefits aren't going to be what you want them to be because the side effects can be significant. When we look at the last couple of lines of this slide, I was just arrested in my thinking when I'm going to give you something to help treat Alzheimer's disease. And one of the things they tell you up front is that you can have these amyloid-related imaging abnormalities, like temporary swelling in the brain. Okay, wait a minute. Before I went to medical school, I knew that swelling in the brain was not good. The brain is in a box with one little opening, and we don't want swelling in the brain, temporary or otherwise. So it's important to fully understand from your doc, going back to something we say all the time, Dr. Jordan, about having a personal practitioner, someone who you can talk with about things like, is this a good medication for this person I love at this point in their illness or at this point in their disease progression? If you are a senior person, you don't want swelling in the brain, you certainly don't want to have any falls. And these are things to think about when you're looking at medications. If you want to temporarily treat memory and thinking symptoms, cholinesterase inhibitors are exactly what they sound like. Cholinesterase breaks down something in your brain, the inhibitors keeps it from breaking stuff down, and so you've got more of it around in order to do what the brain wants it to do. So thinking, language, judgment, other thought processes, these cholinesterase inhibitors are prescribed to treat those symptoms. So you've got the list here. Some are in the, and I'm going to summarize this at the end. You're going to see just how amazing that looks. And I know it's right because I got it from the Alzheimer's Disease Association. There's a nice little table there that has the different drugs and when they're to be used and what they're to be used for. So you can see that different stages in the illness, different medications that can help. As we continue on with glutamate regulators prescribed to improve memory and attention, they regulate the activity of glutamate, which is a different chemical messenger. Again, we're talking about the brain not working right. These plaques and things that don't let it work right and can cover things and stop them from doing what they're doing, these nerves sending messages back and forth in our brain. And at the same time, we can find ways to try to help that functioning. And that's what these medications are used for. So there's a medication that combines the cholinesterolase inhibitor and the glutamate regulator. Again, we're looking at possible side effects. Now, this is a medication that's approved for moderate to severe Alzheimer's disease. If you have someone with severe Alzheimer's disease and you're going to have that person with nausea and vomiting, loss of appetite, increased frequency of bowel movements, headache, constipation, confusion, and dizziness, any of those are a real challenge for someone with severe Alzheimer's dementia. And so again, we want to think carefully as we're trying to treat our loved ones or our patients about what they may have to deal with. And if you've ever worked with folks that have severe Alzheimer's dementia, you really don't want that person with dizziness, increased bowel movements, complaining about headaches. Just none of this is good. So again, very careful thinking about, yes, we're excited there's a new medication that's been approved. Yes, we're concerned about how it may impact the quality of life for this individual. So there is so much information that I wanted to cover, and I'm really mindful of the time. So again, I'm going a little bit quickly through this. I'm happy to answer some questions as we get to the end. And again, this is information that I wanted to show. There's a lot of information, there's a lot going on, so that all of us who have a specific concern about this, either professionally or personally, can know the information is there to go and look up and read about. When you see something that has the little blue and the lines under it, and you find it online, it means you can click on it and get more information. That was news to me, Dr. Hines, because I'm not as young and as facile with a lot of this technology. But it means that somebody has taken the time to put more information about that specific thing into a place where we can find it. So there you go, it's there.
It is a
so
hyperlink. It's called a hyperlink.
You know what? You stop showing off, young person. Hyperlink. Thank you, Dr. Hines. The hyperlink is there for all of us to get to the information that we need. This, again, because Alzheimer's disease, Alzheimer's dementia is a medical condition that we know is caused by a physical change in a part of the body called the brain, right? I'm a psychiatrist. And so I'm concerned about whatever we're doing, whether it's the dementia itself or it's the treatment for the dementia, is it working in some way that is not what we want from a mental health perspective and how people are feeling about things. So I'm looking at this medication that does what it's supposed to do, that is approved for treatment of insomnia and effective for people with mild to moderate Alzheimer's disease. And again, remember, we talked about severe Alzheimer's earlier. We're talking about mild to moderate. And so there are different stages of any sort of an illness or a disease. But again, someone with moderate Alzheimer's disease, we are looking at them probably or possibly having worsening dementia or suicidal thinking, complex sleep behaviors such as sleepwalking and sleep driving. These are real things. And you guys know how I am. I'll toss a little personal nugget in here and there. I remember as my father was going through his battle with dementia, one of the most challenging times for him was he and my mom were staying in a hotel, and he mistook the door to go out of the hotel room for the bathroom door. And when he walked out into the hallway of the hotel and the door closed behind him, he couldn't remember where he was and what he was doing. It was the middle of the night. He's in a room with a hall with a whole bunch of doors on either side. And he wandered around out there for a long time because he couldn't figure out which room was his to go back into. And it was really, really a difficult time for him. So we want to be careful when we're using medications that may have these particular kinds of side effects. Atypical psychotics. Now, these are medications that typically doctors will prescribe for folks that have severe agitation, typically folks that have some sort of a psychosis or someone that has a bipolar condition. And you'll notice that I put in bold there Zyprexa, which is a medication that's also known as olanzapine. I don't know why this is so many doctors' favorite medication to give to people that are elderly and may have dementia. In my very wordy slide here, the FDA requires that all atypical psychotics carry a safety warning that the medication has been associated with an increased risk of death in older patients with dementia-related psychosis. Quick little short story. My mom is 91 years old. Again, Dr. Maxey is her favorite doctor, not me. My mom had a fall and was taken to the hospital. And they decided that because she was in this brand new place, my mom has significant Alzheimer's dementia at this point. And she was in a new place, didn't know anybody, was trying to get out of a hospital bed. They decided to give her olanzapine. And what we wound up having was the doctor calling the next day talking about, well, you know, it's end stage and we want to make sure that she's comfortable. Have you all thought about what happens? You know, people will forget how to eat with severe Alzheimer's. I'm like, hey. I know she's 91 and she's really confused and agitated now, but let me show you a video of her 2 days ago up and talking and playing with her great-grandchildren. I think the problem might be the olanzapine and not the Alzheimer's. Took her off the olanzapine and she's back at the place where she lives and back playing with her great-grandchildren. I don't know. It's just important to talk with doctors about why they're using what they're using, because they could have used Rexulti and maybe had a different effect. But a second person that I know who is about 70 years old and has some challenges was in the hospital, given olanzapine. I don't know why it's so popular. Maybe they have really good salespeople, but also became confused and agitated And I had to talk with the doctor and say, can we try something different than the olanzapine? I'm not trying to put olanzapine down. It's a great medication. I prescribe it also, but I don't prescribe it for elderly people with significant dementia. So again, the side effects are not guaranteed. If everybody had bad side effects and died, they wouldn't have the medication approved and on the market. But it's important for us to know, either professionally or personally, that there are serious side effects, and these warnings are there, so we know what to look out for and then intervene. Okay.
Dr. Watts, would you speak to this while you're talking about side effects? Would you speak to have the conversation with the prescribing provider as to what exactly is the intent of the drug and to what extent the drug is going to have the effect, the desired effect? In other words, they will say, and they got to prove, so they had to prove something, that these drugs do impact the disease progression in some way or another. But to what degree should you reasonably expect any impact by these drugs? And the reason I stopped you at this point is because I was thinking of this topic in terms of the patient and the family from their perspective. And if you have a family member that is suffering from Alzheimer's, obviously you want them cured, but that's not possible. So when the doctor tells you, well, we can give them this and this will make them better, we need to have a real good understanding of what better means.
I couldn't agree more. I tell my patients that I will defend to the death your right to be an individual. And so if you have this reaction or that reaction, it's valid. I want to know what's going on. The one time I use absolutes with every single patient and every person I talk to is I say, anytime any doctor ever prescribes any medication for you, you should be able to understand in very simple terms what the medication is being prescribed for, how you will know the medication is working. And my example is very simple. I got a little headache. I take a couple of Tylenol. My headache goes away. I took the Tylenol for the treatment of the headache. The headache went away, so I know the Tylenol worked. It's very simple for folks to follow. Your doctor, your practitioner should be able to explain to you in very simple terms what they're trying to treat and what it is that either they will know from some sort of a subsequent follow-up test, or you will know from how you feel or what you can see that the medication is working. And then on top of that, what the potential, because everybody won't have the same, but what the potential side effects are. And I always tell folks to look medications up, drugs.com, Mayo Clinic, WebMD, someplace, not only Charlie's chat room or Wendy's website, but look drugs up so you can have some understanding of what potential side effects may be. So your point, Dr. Neighbor-Stevens, is the point, I think, when we go to a practitioner. We have to be able to understand in terms we can understand. Let me stop before I go off. I think it is so important that many times we respect the practitioner to the point that we won't ask a very simple question. People always say to me, well, this is probably a silly question, and I say right back, only if you don't ask it. It's the only ones that are simple. So when people are talking about medications, and let me go to this. This is a very simple, and I promised I would do something like this, right? The treatments at a glance. The name of the medication, what it's indicated for, mild dementia, common side effects. And I think if I remember correctly, I didn't put this in the slide, but because we're talking primarily about Alzheimer's dementia, and because there's no cure, early on in the slides, I talked about there are two things we can look for. We can look to slow the progression. So we're not getting, as Dr. Maxey had asked me about earlier, we're not getting the same level or the same pace of the forming of those plaques that kill the brain cells and kill the functioning of the brain cells so that dementia progresses. So we can slow down the progression, or we have the medications that can treat the symptoms so that even though the Alzheimer's dementia continues to progress, we can help people to be able to function a little bit better and the cognitive function is better. Now, does that mean that over time, the disease is not going to progress and it progresses to a point where it's fatal? That's what Alzheimer's dementia does. No, we don't have anything at this point that's going to keep you, if you have Alzheimer's dementia, from progressing and ultimately losing so much function that you ultimately die. I don't know if that gets to the question you asked. Your question was real short and my answer is ongoing. I'm sorry.
Yeah, well, you are doing just what I wanted you to do, because I'm very concerned about the public perception and understanding of the announcements of these drugs. One thing, these two drugs in particular, but when the others came out, it was the same issue. These drugs, the people who did the studies and all are writing and saying that the maximum impact of the drugs is related to how advanced the disease is at the time the drugs are initiated. Let me be very specific. They wrote and said that it works in early and mild Alzheimer's. It does not work later. And that gets to the next point about from the family situation, family's perception of what's going on. How do you know the difference between mild cognitive impairment and you should start being concerned? Or are we talking about early dementia? Because timing is critical with these drugs. So how do you know when to worry? In our family, and I'm guilty, it was my father. My father was given a new computer by my brother. And my son, who was considered the computer genius in the family, this was 25 years ago, was assigned the task to teach my father how to use his new computer. He had never had a computer before. So dutifully, my son went over to their house every afternoon after school to give his grandfather a tutorial on using his computer. After a month, my son said to me and said, "Mom, some people are computer people and some people are not computer people. Granddad is not a computer person." Looking back on what all happened with my father's disease, that was one of the first signs that he had a significant problem. Now, I didn't live in their house. I lived near them, but I didn't. So I'm sure there were some others, but I didn't want that bad news. And I didn't connect to that very telling observation on the part of my son. A year, maybe not even a year later, my parents went off on a trip, and their practice was for my father, for them to get their suitcases, my mother to stand on the curb with the suitcases while my father walked out to the parking lot to get the car and to come back and pick up my mother and the bags. Well, my father went home and left my mother at the airport. That is when it really clicked in my head. Okay, Houston, we got a serious problem going on. And then, as time went on, other things were happening. And finally, it got to the point I was the one who had to force the issue of taking the car keys away from him. All that, because this is the kind of impact, and these are the issues that families have to deal with as you have a family member affected by these. And I'll never forget when we went to the doctor after the airport issue, the doctor put him on one of the drugs that you listed earlier, and I saw no change, absolutely no change. In fact, he continued to get worse. So that's why I made the comment. You need to understand what it is you're looking for in terms of effect of these drugs so that you know what to do. Now, at that time, there really weren't any alternatives, so there really wasn't anything else to do. But I am concerned because the last two drugs that you showed, the new ones, are very expensive. They are expected to cost $26,500 annually. And what you can expect from that $26,500 is a question that needs to be asked and understood.
Dr. Neighbor-Stevens, I don't have anything but yes to say to what you just said. We had a similar, and what I think what folks who are with us today can see is that there's a lot of personal passion around this subject. I gave you all the story about what happened with my dad. Dr. Neighbor-Stevens was talking about what happened with her dad. We had a conversation last week about my mom and these drugs, and decided as a family that no, we weren't going to start any of these drugs. My mom is at that stage of having severe Alzheimer's dementia, but she is still able to get up and walk around and recognize her kids and enjoy playing with her great grandkids and the potential side effects. Again, I go back to my Tylenol example. I know what I'm taking. I know what I'm taking it for. I know how to tell if it's making any difference. When these medications are prescribed, the folks who will be looking for the changes are not the world's best neurologist. This is going to be somebody in the family who needs to be able to see whether the medication is doing what we want it to do and whether we want to continue the medication and maybe even spend $25,000+ a year for someone when we may not see a benefit. So again, what's exciting about this is that we're making progress. We're making medications that target symptoms and target the actual disease progression. That's wonderful and exciting. Are we there yet? No. Dr. Maxey, I'm sorry, go ahead.
And one of the questions I have, for those of us on the line that we're more than 25 years old, and we all have instances when we question our memory, our progression. What are the things that we should be looking for in ourselves, and what things are just simple? Like I went to the refrigerator and forgot what I was going to get out of the refrigerator. What are the things that we shouldn't freak out about? What are the things that we should have some concern about? Not even getting into the medications yet, just what are some of the simple things that we can be able to monitor ourselves or our loved ones?
So Dr. Maxey, it's an excellent question. At the very beginning, we talked briefly about the things going on around us that can make us forgetful, that can make us stressed. You know, we used to hear people say, well, you're getting on my last nerve, because if things are very stressful for you, you're not going to be as sharp. You're not going to be as patient. You may be irritable. You may miss things. So I don't have anything to say about, oh, this is what you should ignore. You should not ignore, because if you find that you are forgetful, find out why. If you find that you're stumbling for some reason, find out why. So I don't have a list of things for you to not worry about. What I have is anything that is out of the ordinary, we should pay attention to. And
what type of physician or healthcare provider should you go to with your concerns?
Well, you always want to go to your primary care practitioner, whoever's taking care of you, because it may be a medication that you've been prescribed. It may be a medication that is not working. It may be that your blood sugar is not where it needs to be, or your blood pressure is not where it needs to be. So I think now, when you get to how am I diagnosing whether this is dementia or not, then there are 3-word tests. Can you remember these 3 words? There are longer mini mental status exams. There are longer mental status exams. There are full psychological evaluations and other tests that folks do. But you start with whoever is taking care of you, because you mentioned folks who are over 25, like you and me, just a little over 25. And we are typically taking medications for a couple of things. When you get to be a certain age, you typically are taking some drugs, and almost any of those drugs can have some impact on you from a mental status perspective. And then when those drugs mix with each other, they can cause other things. So somebody adds your endocrinologist makes a change in your medication, your psychiatrist doesn't know, your gastroenterology doctor, your GI doc adds a different medication. These things can, so again, for me, I think starting with your primary care practitioner or your family practice doc. I don't know, Dr. Hines, what do you think? You want everybody come into your family practice medicine?
So, yes. There's a question in the chat about, can your primary care doctor do these screening tests? And the answer is yes, right? So it's an excellent place to start, because of the other things that you listed that can sometimes present, like dementia. Another one that is commonly mistaken for dementia is depression, especially in older folks. So when my father, who also has dementia, first started presenting with some things, that's what I thought it was, right? Because several folks in his, little social, my dad used to have his little meet and greet session at this restaurant, and he and these other 4 guys would go hang out in this breakfast spot, like, I don't know, for half a day, right, on the regular. And then essentially, over a relatively short period of time, all but him either passed away or became too sick to keep going, and he lost his social circle. And ultimately, while that wasn't the only issue, depression was part of his issue, because once we started finding some other things for him to do, got him connected, that helped. So yes, your primary care doctor is a place to start. And then, as Dr. Nabert Stevens pointed out, having these conversations about what you want for your person and what you want as a family are important, because people can do tests. You can sit around doing test after test. You can get CAT scans and MRIs and blood tests and all kinds of things. To what end, right? At some point, you have to ask yourself, to what end? There's another question in the chat about how do you know the medicines, and sometimes they'll tell you, if you're on some of these medicines, give it more time as far as seeing if it's working. When my father first started to get to the point where we knew, we had gotten past the space where I was with Dr. Nabert Stevens. My dad, his first one for me was he got his medicines confused, and right. And then there's some other things that if I were to tell you now, that he was telling me that he was seeing a horse and buggy at nighttime with some kids in it. And I was like, people do all kinds of crazy things, because he lived near a farm. And I thought that, who knew? But it was hallucinations. But I had no reason to think that my dad would be having hallucinations. So I didn't put 2 and 2 together. My sister is also a science-minded person. We were able to have a conversation about knowing that these medicines don't necessarily present a cure, but one of the very real things that we were confronted with was needing to do something. We can't just sit here and let this happen. It was feeling like we needed to do something, and subsequently used one of the medicines on your list because we couldn't just not do anything.
Let me ask you a question, Dr. Hines and Dr. Hawks. I know that some of these forms of dementia, we want to be able to preclude if we can. Are there any lifestyle changes, any dietary considerations we should make before this that can help ameliorate or mitigate or make this less happening? And what are the risk factors in our lives for dementia, and in particular, Alzheimer's syndrome?
Okay, so when I tried to figure out what is it that we can do, it seems like everything is better if we are eating well and we are exercising. Our bodies like that. Our body is like a car. You put the right fuel in it, it's going to run better, it's going to run longer. You put the right gas and oil, or in my case, you plug it in, because my little Chevrolet Bolt doesn't need any gas or oil. But leafy green vegetables, berries, whole grains, fish, poultry, beans, nuts. These are things that tend to be in the Mediterranean diet. I'm not trying to say get on a diet and lose weight. I'm trying to say, what are you putting into your body that makes your body tend to work better? What should you not put in your body that may make it not work better? Sugary snacks, a lot of processed meats, a lot of alcohol. People who, again, this isn't just for prevention or slowing down or decreasing your risk of Alzheimer's dementia. This is just what's good for you. So if you go back to all the episodes of Black Health Trust and look at every time that we've talked about what you should put into your body and what you should do with your body, yeah, those are the things that make a difference. So yes, Dr. Maxey, being active, eating a better, healthier diet, not smoking, keeping blood pressure under control, keeping cholesterol under control. And especially as we're moving, I mentioned the youngest described case of Alzheimer's was somebody who is 19. That is atypical. We shouldn't all be testing our teenagers to see if they're developing Alzheimer's dementia. But what we should be doing as we get past 25, Dr. Maxey, and get to be around 40 or 50, and when you get there, I want you to make sure that as you age into that group that's 40 or 50, that you are making sure your blood sugar is low. Because all the things we know that damage our body along the way. Everybody, oh, you know, when I retire, I'm going to get in shape and start taking care of myself. No, you won't.
Well, Dr. Marks, one thing that you make very clear, and I do a lot of MRIs on patients that are senior, and almost to a person, you find something called white matter disease. And white matter disease is in part caused by these amyloid fibrils that you talk about, and it results in part from high blood pressure, from diabetes, and from other substances that have gotten into the brain. So I want to make sure we get a chance to open up for audience questions that are specific about concerns they have. Because, and the other question for you before we do that, is there increased risk for Black people for Alzheimer's and dementia?
Dr. Maxey, first of all, women are twice as represented as men with Alzheimer's disease. And they say it's because, well, not they say, that's always an easy cop-out. One of the things that is thought is that because women live longer, but women don't live that much longer, I think. Maybe I'm just confused, but women don't live twice as long as men. So the fact that twice as many Alzheimer's disease patients are women as are men can be an issue. There's also a concern about hereditary. There's a slightly more increased risk if someone in your family has had Alzheimer's dementia, and that has not had it. So if you've got a family history, you're at a slightly increased risk. It's not massive. There's no guarantee that you're going to get it, but there is an increased risk. And the answer to your question, if you're Black, are you more likely? Yes. What? Okay. Can you name 3 things that we are not more likely to get? Tay-Sachs disease. What else?
That was my go-to.
Right. I knew one of y'all was going to say Tay-Sachs disease, which is a serious illness that impacts a large part of our community, but not us. But almost everything else, in the immortal words of my friend, Dr. Reverend Jesse Jackson, we are the sickest and we are dying the quickest.
Can we see if we have any questions or comments from our lay audience?
Dr. Sherrod has had her hand up for a while. So if we could recognize Dr. Sherrod, and then I know Dr. Hines has been monitoring the chat.
Dr. Jesse Sherrod.
Oh, yes. Good morning. First, I want to commend Dr. Walks on such a great presentation and the discussion with all of the leaders of the Black Health Trust has been just very important. This is a very difficult subject, and I know everybody has probably some experience to some extent, either in their family or in their friends with this. My mother actually passed away from Alzheimer's, but I wanted to bring up two things. One, there's a neurologist named Dr. Perlmutter. He's world renowned. He specializes in integrative medicine. And this was back in 2003. I had a cousin who had been diagnosed by his primary care doctor as having Alzheimer's. And of course, he was on the medications, but was not getting better. So his wife called me and said, "What would you recommend?" At that time, I was doing some integrative education for myself. And there was a compound called Brain Sustain. And I want people to remember this because Brain Sustain is what I recommended for my cousin. And he took it every day. He actually became back to himself again, quote unquote. I won't say back to normal, but back to himself. He could function, take care of himself, actually outlived his wife and was able to live in an assisted living facility and until his death. In that same office, there was a school teacher who came in with similar symptoms of dementia or Alzheimer's, and they gave her the Brain Sustain. This is back in early 2003. She was able to go back to work. Now, I'm not saying that this is a cure for everybody, but it is a nutritional support that was developed by a neurologist whose father was a cardiologist and had Alzheimer's. And he was so disturbed about the lack of effectiveness of the traditional pharmaceutical medications that he developed this compound himself as a neurologist. It is still out there. You can get it from Whole Scripts. It has to be provided by a medical provider. You cannot get it as a patient. So if you mention it to your provider, it could always be added to whatever else you're doing because it's basic nutritional brain support that was developed by a neurologist. Now, the other thing that Dr. Maxey brought up is the MRI scan. There is a functional MRI scan now out there that's been out there probably about 10 years that can be utilized supposedly to confirm the diagnosis of Alzheimer's, of dementia, and what it will tell you what's going on in the brain. So that's something to keep in mind. It's called a functional MRI scan. And then there's another marker, and I can't remember exactly the name of it, but I think it's called APOE. Has anybody heard of that? That's supposed to be predictive for people who are at higher risk for developing Alzheimer's. I just want to say this too, that and this is a personal story, when I was first diagnosed.
I'm going to get a few more people in, Dr.
Yeah, let me just say this, Dr. Max, and that is, I could not balance my checkbook. I could not remember how to add up things. This was when I was first diagnosed with chronic fatigue syndrome and fibromyalgia. And I was able to get my brain function back through methyl B12, which I got from a conference that was given for kids with autism. So I use B12, methyl B12. So vitamins and nutrients are also very important in trying to work this out because these medications will not cure, and the nutritional part may not cure, but may be able to reverse some of the symptoms if it's not too far. Thank you so much.
Thank you.
Thank you, Dr. Sherrod. I just wanted to say that.
Questions or comments in the chat?
The apolipoprotein E that Dr. Sherrod talked about is a gene marker that is part of the carrying cholesterol and other types of fat through the bloodstream, and so it is a marker that can be looked at to see if you are at higher risk for Alzheimer's dementia. So thank you for that, Dr. Sherrod. Anything else in the chat, Dr. Hines?
There are several recommendations on resources to find some of the other natural supplements that
So-
could be used to address Alzheimer's symptoms. And then I think the rest of the things we've kind of covered either directly or indirectly.
Okay,
Okay,
let me
make
comment on
one
something
other-
that I found.
Sorry, Dr. Maxey, go ahead.
I'm giving a lecture next month in New Orleans at the National Medical Association Conference on apolipoprotein 1, which causes kidney disease. And it's a gene that is on the 22nd position on the chromosome. And it is related to HDL, high density lipoprotein. And it turns out, based upon what Dr. Hines has said and others, we're finding many of these things that are soluble in circulation and body fluids that are the markers for these diseases that affect our people. And we're going to find more and more of these, and these new treatments depend upon that. This particular gene destroys the podocytes and glomeruli of the kidney. Some of them deal with the brain. We notice that almost all of these drugs also affect in a positive way the cardiovascular system. So I think more and more as we get to personalized, individualized medicine, when that how we started out and how we treated our body with nutrition and exercise and lifestyle is going to be the end result that we're now calling disease. That's my opinion.
And that's a very good and important opinion, Dr. Maxey, because as science progresses and as we learn more, I wanted to make one other comment as part of this overall discussion. So many times we are dismissed, especially as we get older. Oh, it's nothing to worry about, or oh, this is just part of getting old. There are some real processes that can be treated that can be confused with someone developing a dementia. Dr. Hines talked about depression, which can be confused with dementia or can co-occur as someone is developing dementia. We don't often think about urinary tract infections, especially in men. Urinary tract infections can be a significant cause of cognitive decline. Thyroid disease, diabetes, Lyme disease, vitamin B12 deficiency. And I know Dr. Gibson had put a couple of comments in the chat about drugs and drug interactions. So it is not as simple as saying, you're getting old and people get forgetful as they get old. No, that's not what this conversation is about. This conversation is about understanding that we need to hold the folks who are our practitioners accountable for thinking beyond just the fact that we might be 60, 70, 80, 90, 100 years old. There are a lot of people that are 100 years old that are still pretty sharp and got a couple more years to go. So that's the end of this particular presentation on my part. And Dr. Maxey, thank you for sending me the information you sent me to help put this together. I was going to take all the credit, but what you gonna
I do have a short case I want to present to you, Dr. Walks and Dr. Stevens and Dr. Hines. I have a cousin located on the East Coast, and she's about 72, 73, beautiful, vivacious, and very loquacious, if you get my meaning. And recently her family complained that she is forgetting things, she can't find her keys, she normally takes excellent notes, but she doesn't remember a meeting. And I'm concerned for that family, how they would approach this normally vivacious, very bright young lady with this impending problem, and where they should take her and what type of testing should we do on her.
Okay, so Dr. Maxey.
And some of her family members are on the phone as we speak on this call.
So two things. While I'm responding to this, can we unmute Dr. Lisa Kerwin-Dawes, who has her hand up? And just briefly, I would say we want to take your family member, Dr. Maxey, back to her primary care practitioner, who can all that list of things from B12 deficiency to thyroid to UTIs to everything else I mentioned. They can check for any of those things that may be going on. They can check for depression or some other mental health process that might be going on. They can ask questions about all the medication interactions. It's important that someone who is conducting your healthcare orchestra, someone who is able to look at, the violins and the cellos and the horns and whatever, to see how things are meshing in your overall healthcare plan. So yes, start with the primary care and see where things go. And Dr. Hines.
Just real quick, in that same space, sometimes in the beginning, it can feel awkward to talk about your person in front of them, right? Like, especially if you're going to be saying things that you think that they may not like. In the past, physicians didn't seem to be very open to having appointments if the person wasn't physically present. But what seems to be more acceptable now is you can make an appointment with that person's PCP to discuss your concerns on their behalf, right? Even if the individual is not present.
In fact, I think it's recommended that you have a family as a witness to what's going on, because often the patient themselves may not be able to appropriately describe what's going on.
So Dr. Lisa, yes, ma'am.
Okay, I have two comments. One is I looked at the Brain Sustain. It actually has some really good things that we add in Jamaica for Alzheimer's. We also do very high dose cold pressed coconut oil. I had to come in and out of your meeting, so I'm not sure if that's talked about, because I myself had seen some improvement. In terms of the white plaques and changes in the brain, I did have a patient who, actually a woman in her 50s who was getting forgetful, who we ended up doing an MRI on. And she was a lawyer and she had some big white plaques, and we discussed all the things about it. Very interestingly, this was about 6 years ago. And she said, I got to change my life. She left her husband. She changed her job. I repeated her MRI about 4 months ago. All those white plaques had returned to normal, which really surprised me. I actually repeated them, the demyelination, more to see if we had halted it, but they all went back to normal. At the same time, though, we did add a lot of herbal products at the same time. Some of them which are in brain, yes?
Are you making a social comment about people should leave their...
No, I'm not. It's just that was what she considered. Her husband was very, very stressful. If you notice, I said she changed her job also. You sort of jumped over that part. So pretty much she changed her life quite a bit. What surprised me was a lot of the brain changes actually reversed. I was more expecting, hopefully, for it not to progress as much. But I'm not saying it's all just stress, because besides the lifestyle, we did add, as I said, a bunch of other herbal products. I just looked at the Brain Sustain, some of the same things we recommend for people here, as well with Alzheimer's, as well as the coconut oil.
Well, thank you.
That was my comment.
I think we're past at the top of the hour. Unless there's something burning in the chat, let's get final comments from our co-moderators, starting with Dr. Hines.
Thank you, everyone, for sharing your personal experiences and stories in this space. I will also just add that one of the benefits of information sharing is resource sharing. And especially in some of the mild and moderate stages of dementia, there are lots of things that you can put in place to support folks so that they can stay in their homes and maintain maximal levels of independence, even if they have a diagnosis of dementia. So just wanted to put that out there.
Okay, Dr. Ivan Walks. Thank you so much for your presentation. Very, very interesting and information I believe is going to be very helpful to all of us, especially those of 25.
Well, for those of us over 25 and those of us who have people under 25, that still depend on us. This is a very important topic. It's one that certainly piqued a lot of interest for folks in the chat. I also appreciate folks making this personal and sharing their personal stories. This is hard, and I don't want anyone to miss the non-inevitability of someone who is having trouble with their memory, who may be stumbling around, who may be having some real obvious changes, because it may not be something like ongoing terminal process like Alzheimer's disease. It could be something else. And then I also appreciate, even though we do not recommend and prescribe specific medications here on the Black Health Trust, it's not the function of this particular forum. I appreciate Dr. Lisa Kerr-Dawes being able to share with us some of the things that they're doing in Jamaica and some of the results that they're getting. And I also appreciate Dr. Sherrod sharing her personal experience about something that worked for her and has worked with people that she knows. So often people are told, nothing we can do, see you later. Not Dr. Lisa Kerr-Dawes, not Dr. Jesse Sherrod. They're willing to share with us their experiences. And though we're not prescribing anything on Black Health Trust, the opportunity for us to share and learn from each other is much appreciated.
Very important. And before Dr. Barbara Neighbor-Stevens gives her last comment, is Dr. Tony Brown on the line by any chance?
I don't see it today, Dr. Maxey.
His phone number starts in 267. He's also in New Hampshire. And the reason I bring that up, he has reached out to me and he's doing some long distance brain mapping, brain testing for cognitive areas. He gave the talk a few months ago on your brain. Maybe we can have him back based upon how many people are interested in this. I think that can be very good. Dr. Barbara Neighbor-Stevens.
Thank you, Dr. Maxey. Thank you, Dr. Walks, Dr. Hines, and our whole community. I wanted to just end on a general comment for you to bear in mind as you go about interacting with your family and your friends. Mild cognitive impairment are those changes in memory or thinking, but the changes don't affect your ability to do your day-to-day activities. Once it crosses the line and it begins to impact your day-to-day life, then the question of dementia is raised. So people were asking, is it normal to occasionally forget? Yes, especially if you're distracted, tired, no matter what your age, multitasking, sleep deprived, all of those good things that we talked about. But when you can't remember that you just told somebody a story, that is clearly across that line. So I hope that helps to frame what we were talking about. We were focusing on Alzheimer's, but we all have those questions. Am I beginning to lose it? Am I beginning to lose it? Well, this will possibly help you to decide whether or not you need to seek additional attention.
Let me just go back to Dr. Walks one more time, if you don't mind. Are there any simple things we can do to put some of this dementia off, some mnemonics we can remember? How can we give a note to ourselves to make ourselves less susceptible to what's going on with this memory loss, Dr. Walks?
I'm just channeling Dr. Neighbor-Stevens right now. Use common sense. If we want our bodies to work well, we have to treat them well. We do all sorts of things, Dr. Maxey, that make no sense to our body. If our body could yell and slap us in the face, it would say, stop eating French fries every day. Stop sitting up in the house every day. Get up and move around, eat those nuts and those berries and those healthy things. Get some green leafy vegetables. There are no big secrets here. We talk about this all the time. So use common sense about what we put into our body and expect that our body will react in a way that we want it to.
Okay, and as my final word, one of the things that I do since I'm a year over 25, my favorite function on my iPhone, I presume the other phones have it too, is my calendar. And every morning when I get up, the first thing I do is put everything that I want to get accomplished that day into my schedule. I'm going to do it at 8 o'clock, 9 o'clock, 10 o'clock, and list names and things I want to do. It doesn't totally cure it, but it makes sure I do remember the main things. I can go back and review what I might have forgotten. But with that said, I appreciate everybody's time today on this beautiful Sunday. We thank Simon for his help. We thank you, Kenny Stevens, for her help. Have a great Sunday afternoon. Thank you,
Bye,
Dr.
everyone.
for the presentation.